encourage and welcome, chat, chatter in the chat, raising your hand to unmute yourself and verbally either add comments or ask questions. We're really hoping for an engaging, collaborative discussion today on some of these topics. So please don't hesitate to chat with your questions, or like I said, raise your hand and unmute. Welcome to today's NIH Data Management and Sharing Pilot Update session. My name is Melissa Korf. I'm from Harvard Medical School, and I'm joined by the pilot co-leads, Christi Keene from University of Chicago, Jim Luther from Yale, and Michelle Bowles from NIH Opera. Next slide, please. Great, so a little bit of our agenda for today. We're gonna start with some background. Some of you may have heard us say this many times, but every now and then we're joined by new colleagues. We want to make sure everyone gets the setting of the stage. We'll provide some summary of IC observations shared during a recent town hall last month. We'll go over preliminary results from a researcher survey as part of the FGP pilot, a little bit of a discussion about how institutions are planning for oversight of data management and sharing plans. And then we'll get into some details of phase 2 planning and hopefully leave some time for discussion of other related topics. So as we've probably talked about it multiple times before, if you were reading through the new, I think we can still call it new, it's a year old now, Data Management and Sharing Policy, you might have thought to yourself, this is a little bit vague. And it's intentionally that way. The NIH funds a huge variety of fields and projects that have a widely varying data needs and data types. And the policy needed to allow flexibility so that, all of the various ICs could meet the needs of the fields and the projects that they fund. But that flexibility is both a blessing and potentially a curse when it comes to administrative burden, in that all of those ICs could have come up with their own IC-specific templates or even potentially program-specific templates. And so we kicked off the pilot, I think this was Michelle's wonderful brainchild, to try to generate some consistency in DMS plan requirements across NIH ICs and programs, thereby mitigating the administrative burden for researchers associated with plan development and implementation. And we've had a really wonderful collaboration with some IC representatives that have really been engaged with us throughout the whole pilot process, and really providing a lot of wonderful, expertise and perspective on IC needs. It's really been a wonderful collaboration. Next slide. So we started with phase 1, which is the DMS plan template pilot, and working with the IC colleagues created 2 core pilot templates. Alpha, which is a very prescriptive template designed to limit the need for free text entry. And it is a smart form fillable PDF. So, certain questions only show up based on your answers to other questions and things like that. And then Bravo template, which is published in a Word doc form and aims to provide detailed prompts, but also allow a little bit more flexibility for free text responses when necessary. We have been gathering data from the researcher faculty perspective, as well as seeking feedback from our IC colleagues on how it's going and what they're seeing in terms of plan submissions. And then we've also created a Qualtrics survey for support providers to provide feedback. So we recognize that research administrators, folks in the library, folks in research computing, IT support may have a unique perspective on how it's going with a variety of the different plans as they're supporting multiple researchers that are trying to create their DMS plans. And so we welcome feedback from that perspective as well, in terms of, you know, when I help people out, I far prefer this template. I far prefer addressing this question this way. If you've tried one of the pilot templates, if you're one of our faculty representatives out there, you're a researcher that's actually created one of the templates or created a plan using one of the templates, you don't have to be part of an institution that's formally part of the pilot. We welcome anyone who gives one of the template pilots a try to share their feedback with us, and that link is there on the bottom. Next slide, please. So NIH has been wonderful in facilitating some great, feedback and information sharing sessions with the pilot and the FGP community. And most recently, at the end of December or mid-December, we had a town hall, which is designed to be a listening session open to anyone who's interested, FGP pilot participants, FGP members, other proposers to and recipients of awards from NIH. Recordings and session materials have been made available both on the learning page of the sharing.nih.gov website, as well as on the pilot webpage. We've linked back to that site as well, so you can find them through both methods. And prior to the most recent one in December, we had a couple sprinkled throughout. Another great just sort of outreach and communication tool is, we were so pleased that Mike recently posted an open mic blog post, advertising the pilot and welcoming anyone who's interested to try the pilot templates. And a huge thank you to Michelle and Christi and our other NIH colleagues for working with Mike on that. I think it's a really important opportunity to get the word out on the pilot, and that the pilot templates are out there. And Michelle, I don't know if there's anything else you would want to share on that blog post.
No, I just really appreciate the dedication of Mike, just wanting to make sure that this is successful. And I think that that's the message here.
Yeah, it was a really great blog post, and was so pleased to see the advertisement there for our little pilot and for the templates. Next slide, I think. Oh, yeah. And so this is the list of everyone who has agreed to formally participate in phase 1 of the pilot so far. So these are the institutions that have agreed to be providing quarterly reports, and otherwise participating in a little greater detail. But I think, as mentioned in the open mic blog post and in other venues, anyone is welcome to try out the pilot templates. Our only ask is that if you try one of them, that you share your experiences and your feedback with us through the Qualtrics survey. Next slide. All right, and I think I'm going to pass it off to you, Michelle, to share some summary of the NIH IC observations.
Thank you. Next slide. And so we have observations from several of our institutes and centers, and I really want to give a shout out to all of the ICs that have participated. This has been really fruitful for us, and I believe for the community. And I think it's the first time that we've engaged our program officials in an FDP pilot, and the way in which we've just interacted, the way in which we've been able to identify challenges and observations and talking through future discussions and challenges and successes has been amazing. So while we within Opera get a chance to work with our program officials on a almost daily basis, you all had an opportunity to work, Jim, Christi, and Melissa had an opportunity to work with our program officials during this pilot. And I think it's just been so successful as a result of that different kind of partnership and different perspective. So we've listed here the preliminary observations of the various ICs here. Next slide. So most of the applicants, what we identified from our IC participants is that they're using the OER DMS plan format page. We've identified the fact that there's various and vague reasons for not sharing data, not necessarily clear to us, and maybe not even clear to them at this point, but we have to remember this is still new. And I think that all of these pieces will come together at some point. Planning to share through publication and conferences or by request, not using the established repository or not committing to one at all. Naming a repository that's not a good fit and it's just broadly accessible and inappropriate for the data type. And when they're listing the multiple repositories, they're not indicating which data goes to which can be problematic. Lacking budget requests and lacking details where there is a budget request, which we look forward to addressing in phase 2. And then the plans that are used that used any template or included tables or lists were more likely to meet the policy requirements. And so I want to just stop there for a second and just talk a little bit about the fact that all of the common themes that we're identifying here is going to help us create the best template that we believe will get the recipients, you all, what you want and comply with the NIH data management and sharing requirements. I think it's so important for us to take this feedback in and really tailor our final destination, which would be the final template, to what we're hearing here. So this is really, really important information. And then, of course, all data proposed in the research plan or the grant application should be discussed in the DMS plans. And we just really believe that this was like the preliminary data. So having that information readily available to us and seeing the common themes, it just will take us to the next successful phase of the FDP pilot. Next slide.
Okay, and I'll take it from here, Michelle.
Thank you.
All right, so as Melissa mentioned, we have a survey out there for submitters to provide feedback on their experiences when submitting plans. So this is a really important part of getting to an appropriate plan. So one of the first questions we ask is what template did you submit? And so what we've seen so far is that people are selecting alpha, which I think we'll talk a little bit about maybe the challenges of alpha. Melissa mentioned it's a smart form, maybe a little too smart for some systems or for some versions of Adobe. We have heard that there's some technological challenges with alpha, but it is still the most submitted or most used template, followed by Bravo and the sample format page, and then a smattering of others are being used. So we want to address the time spent to complete the plan and look at what that experience is for those submitting plans. And as you can see, roughly half are spending 2 hours or less creating their plan. And it goes up to as much as more than 30 hours to submit that plan. So I think, if we can look at maybe experience levels with submitting data management sharing plans versus time spent, there could be some correlation there. But I think as time goes on, everyone will get more adept at that. We also ask who is assisting you in completing your plans. We recognize that it doesn't happen in a silo necessarily, and we're seeing that most people are getting assistance in some shape or form from others, and then we look at who those others are. And here you can see that research administrators are being tapped to assist with these plans more than any other area. I do wonder as time goes on and as people get more familiar with the resources available at their institutions, and perhaps as institutions assess there's staffing needs related to this, that maybe we'll see a shift in who's helping, thinking more like the library might be of more assistance, IT. And so I think it'll be interesting as time goes on to see where that help is coming from for this. And then, of course, how much time did others spend assisting you? So for the most part, that's, again, 2 hours or less. And in some cases, there was no assistance needed at all from those other offices. But again, I think as time goes on, there are some really valuable resources in the library or the IT space. And so tapping into those resources might be helpful. And then we wanted to find out if there's going to be an adjustment to standard practices in a lab in order to implement the plan as proposed. And some variety of yes, I think is kind of what we're seeing. In some shape or form, there will need to be adjustments, be it small or large, to standard practices in labs to comply with the plan as proposed. We've also partnered with dmptool.org. Very grateful for their partnership in all of this. They've been very helpful in getting these plan templates into DMP Tool, which if your institution is not using it, you can go out to their website and check it out. The plans are available there, and we find that 238 uses of alpha and 51 uses of Bravo in DMP Tool, which more or less the proportions coincide with what we're seeing on the survey. We do ask that if you use DMP Tool and use a template, please still submit a submitter survey so we can get your feedback there. We also asked some qualitative questions in our survey, and I touched on this earlier, that there's been some technical issues trying to use alpha specifically. It requires that you download it, and then you can't just fill it out from your web browser. And depending on your version of Adobe, you may or may not be successful there. Additionally, people have said that they need more guidance on the level of detail required, instructions on how to complete the plan, and information on what meets data management sharing best practices, and specifically more guidance when using secondary data. We've been told that the pilot templates seem more targeted towards human subjects research. And I think Michelle touched on this in the early feedback from the ICs, that people are saying it's difficult to know at the outset some of the information requested at the proposal stage. But that is also some of the feedback the ICs are saying is really limiting their ability to accurately and adequately assess the plans. And then in some cases, the plans seem long and request potentially redundant information. So, I think, as Michelle said, we need to take all of this feedback from institutions and from ICs into account when we're thinking about the best template and what that looks like to get the information for everyone to move forward with the plan. Additionally, if you are still interested in joining, it's not too late. Phase 1 continues. We're still accepting new participating organizations. If you would like a seat at that table, please shoot us an email. We can get the MOU to you, and we would welcome new members. And I will hand it off to Melissa.
So one of the things that we wanted to try to have an open discussion with you all on is we've done our plans and we've started receiving awards that include an approved plan in them. And sort of the next phase for us is implementing those plans and monitoring how it's going. So that's sort of element 6 of the DMS plan, oversight, which should indicate how compliance with the plan will be monitored and managed, frequency of oversight, and by whom. And so we wanted to open up the floor for discussion if anyone is willing to share how your institution is planning to approach monitoring and oversight, and if there's any guidance your institution has provided on completing this section of the plan. I think I've mentioned in other sessions that Harvard has provided some tip sheets, both for our grant managers and PIs to use while they're working on pulling together an application, as well as a sort of a tip sheet from our central reviewer, central research administrator feedback. And the guidance that we've provided is that the roles and responsibilities should really be within the research team. We provided, you know, some sample language that we thought, you know, could be used as a starting point. Hopefully to be tweaked a little bit with specifics by the PI. And then we also said that we thought, you know, section 6, the oversight section would be a great place also to indicate any kind of allocation of roles and responsibilities with any subrecipients. So as we all know, there's one plan that gets submitted and that needs to account for any kind of data management and sharing activities with subrecipients, and that's sort of saying who would be responsible for which parts. That section might be a great place to do that. But wondering what other folks have been providing for guidance on this component of the plan, or have been thinking about in terms of oversight. Has anyone designated an institutional official, you know, providing other guidance on, you know, preparing for that first RPPR?
I really think it's important for folks to, you know, kind of pipe up there. I think you're in a safe space in that, you know, us having these discussions will help the pilot. It also will help the NIH folks that are on the presentation understand how we can make things better. So don't at all feel shy, please.
Michelle, there is a question in the chat from Laura. We're hearing that one IC will not allow the PI to be listed as the one responsible for compliance. So, yeah.
Yeah. I think you have to have some separation of duties there. And I can understand why the IC wouldn't want to leave compliance to the PI when the institutional official is where the compliance piece comes in. So I don't know that I would be comfortable with the PI being the sole person that would be responsible for compliance.
There's one comment in the chat. If leaving it to the PI, what happens if the plan is not followed?
Right.
And I think that's a fair feedback, right? We know
right.
that the institution is the recipient of the award, and
that's where compliance responsibilities lie, you know?
Yeah. Right. But at the same time, it's such a challenge. You know, I right or wrong, make an analogy between the DMS plan and the specific aims, right? Like, I know that my institution is on the hook if someone you know, changes the specific aims without prior approval, but as an administrator, I'm very limited beyond just saying, hey, have you changed, you've made this significant rebudgeting, have your specific aims changed as a result? If they say, oh no, as an administrator, I've got limited ability to kind of verify that, right? And so it can be very tricky for administrator compliance professionals to think about, what are the right intervals maybe to ask questions, to be able to identify issues that require prior approval. But, we may have to rely to a certain extent on PIs to answer those questions, they're the ones with the direct insight, and there's a lot in the chat.
Yeah, I got tickled by Melinda taking you up on the safe space. All right, so I'm going to go back up a little bit, and you guys can feel free to jump in as well.
So Michelle, just while you're reading, there's lots of examples where the PI is responsible with institutional support. So, one of the questions in here is from Amy Cool-Shuckers. I'm interested in learning how under-resourced institutions might handle higher level beyond the PI compliance. I think Amy's point is a good one about under-resourced, but I don't think it's any different for large institutions on scale. I think in some of the discussion is NIH has directed us to be compliant with the plan. Different institutions are going to do it different ways. The PI certainly may have primary responsibility. I don't know what the right descriptor is, but is it appropriate for an institution to maybe create a service center of collective librarians and data specialists and others that is budgeted in the proposal, and they periodically go in throughout the life of the award? Is it a local chair, a departmental responsibility? Is it the VPR level responsibility? That's what we're troubled with. And then again, as mentioned in here, in a number of places, in some cases, they're asking for the name of the individual and a title.
And so it does talk about the title in question number 6, but it doesn't specifically talk about the name of the individual. And I think whatever the institution, I don't think NIH can dictate who you assign, with the exception of, I do think that there's a level of risk just by the very nature of having a PI be the only person that is reviewing and complying and not having any accountability. But again, if that's the way in which an institution wants to do that, I think NIH would need to put out some guidance there. Now, I do think that would be really concerning, just from a compliance perspective. But in terms, because I know that there's been some questions about whether or not the individual should be named. And I think that there was one institute that may have required that. And I think that's something that we're going to be talking about internally. But we don't have, I don't see the need to identify an individual. I do see a need to identify, the title or whatever the case may be, once the institution has that information and it's available. And remember, this is going to evolve. And so I think that it might be a situation where the institution has identified a central area, like some of our ICs have done, that review plans or put the plans together, or whatever the case may be, of whomever the individuals are, whether it's the librarian or VP or whatever the case may be. But I do think that there is a need to recognize that if that setup or structure doesn't work for a certain institution, that you all should be able to modify that and alert the IC that that's the case. And that's why I think it's really, we should be very careful about NIH dictating what that looks like, because that might not be something that the institution can do at the outset. the resources may not be there. And if you do that, are you going to request that in the budget, right? So, there's a fine line for what we should be mandating in terms of how you all implement. I think the implementation needs to be left up to you all with identifying those risks, like not having, someone other than the PI doing it.
So one of the other things, Michelle, that came up is the idea of defining reasonableness, right? What is a reasonable standard for making sure that we have compliance? Certainly controls in place that if certain things require change, that require prior approval, that we're in tune to that, so that we as institutional officials can oversee that. But it's difficult.
Yeah, and I don't know that we should be defining the reasonable part of it. I mean, I don't think there's a reasonable definition, right? I think it's, professional judgment and making sure that whatever it is, you all are communicating it in your plan. And if the plan is accepted, then, fine. But I don't think we should be defining what's reasonable. The policy itself identifies the fact that if you make changes to the already pre-approved plan, that you have to come in for prior approval, and then we reassess. And so any changes to those areas we would want to see. And I think that's a discussion that the institutions should be having with the IC program officials on, is this acceptable based on the nature of the research? I mean, someone put in the chat that they are very concerned about diverting funds away from science to do this. And that's a fair statement. It's a very fair statement. But it's a part of science, right?
So
promote science even more.
One comment I saw in the chat from Shauna related to ORCID, and it makes me think about some of the conversations we'd had with DMP tool folks as well, is that it strikes me that, publications have gotten to a point where it's really easy to look up this publication is compliant or it's not, right? And that what we're maybe really feeling as administrators is we don't have some of those same tools yet. I'm going to have a growth mindset on this. We don't have some of those same tools yet for something like compliance with open access and data sharing requirements with data. And so maybe it's working with colleagues like ORCID and DMP tool to create resources that would allow us to kind of efficiently keep track of the products of data management plans. And maybe we're struggling because we're just not there yet.
There was a comment about engaging audit or compliance offices to design an audit or monitoring plan for DMS plans. And I can say at my own institution, our internal audit has been engaged in this, and they've been really helpful in making sure all the right offices are identified when we're thinking about compliance. And then obviously revisiting as time goes on and we start thinking about our PPR. But that is, I think, a helpful resource in navigating and bringing together the different areas within your institution. Because yes, compliance it's hard to live in one space and ignore other spaces.
So Michelle and others, I stated this and I tried to clarify it in the chat. Would you agree that if an institution wanted to set up a shared resource center and hire 5 FTEs, 3 FTEs, 1 FTE with librarian skills and IT skills and data management skills and so forth, that could be something that could be budgeted in the proposal. And then if I were that individual, I would go out and periodically work with the PI and work with the appropriate people on the grant to make sure are they in compliance with the plan and so forth. And that would be a direct charge to the grant.
Jim, I'm not going to answer the question about whether it would be appropriate. I think if an institution wants to set up its own central place and that works for that institution, then put it in the budget and in the plan, and if it's approved, then we know the answer. I don't know that on this call, I can make that judgment.
Sure. Yeah. That probably wasn't a fair question, but you understand the theme there is that many institutions are saying more burden, more cost, no process, more people, it's difficult. We all understand the importance of compliance on it, but we're also all trying to balance the cost. So, okay.
Yeah, I mean, it's funny because every requirement that
right.
the government puts out, unfortunately, it's more requirements and not giving you any more money to do it. And especially on CAP programs. I'm very aware of that, but I think we have to be careful in this setting. That's a discussion that needs to take place internally. And again, we've already said that if there are direct costs that need to be charged to support DMS costs, then, and they are allowable by all means, sure, but it goes back to the point of balancing, because then it does take away from the program dollars too.
So it strikes me, and Michelle, Jim, Christi, maybe one of the things that we can take back for our potential pilot purposes is to think about, so my faculty rep who's in this session right now, talks a lot about the promise of ELNs to help data be born fair, right, and create some efficiencies in data sharing, and that perhaps we need to be maybe discussing or exploring potential ways to create efficiencies in the monitoring as well. And maybe, coming up with some best practices or exploring in more earnest the tools that might be, that we might be able to use to more efficiently meet our obligation to monitor and ensure compliance. And maybe that's one of the things that we can talk about. But one question that I think is interesting, and it's a little bit of a diversion from this particular topic, but are there any NIH restrictions on using generative AI to assist with developing the plan?
Not that I know of, but I think we need to be careful with that. And I can take that question back to the DMS leads as well as Dr. Lauer, because I think that would be a really good question for NIH leadership to address.
I think that would be great, Michelle. I think that would be a fascinating answer. Do we want to take this back to the pilot and kind of think about if there's some resources or tools that we could talk about and move on to different topics? I know there's still a lot of discussion in the chat on this.
Yeah, I think so, Melissa, with the thought that if someone has tools or knows of tools that are available or are assisting you now, please feel free to share those with us and we can dig into that a little bit more.
Yeah. One comment that's been made a couple times in the chat is JIT stage feedback, and that it sounds a little bit like folks are experiencing POs reaching out directly to the PI and with their feedback on the submitted plan. And though it's my understanding that any final revised plan still has to go through the AOR as is customarily required for any kind of GAT request. A lot of us would find it really helpful to be copied on that feedback when it goes to the PI, so that we are aware of what the feedback is, and so that we can learn and we can help our other investigators learn from that feedback, but also so that we're prepared for that revised plan, like to follow up on it and then to evaluate and review it when it comes through. And I don't know if there's any opportunity to maybe ask POs to copy the AOR when they send that initial request for revisions.
Okay, we're still getting questions, but I think we'll go to the next slide and keep moving.
All that discussion was actually an excellent segue into the phase 2 that we've discussed some time. So Sarah is going to save all of the chat for this entire meeting for us. Michelle, Christi, Melissa, Christian, myself will take a look at that, and we'll certainly be in touch. They're great discussions. And when Melissa threw this on the agenda, we didn't know how active the discussion was going to be. So thanks for all the great feedback. As we've talked before, this was a 2-phase initiative. And to clarify, we're not suggesting that talking about phase 2 as an end of phase 1. That's absolutely not the case. Phase 1, full steam ahead, still taking interested parties, as Christi said in her section of the discussion. But we do want to understand some of the cost policies a bit. Next slide. And this is some of the initial discussion and observations from the ICs. And Michelle, feel free to jump in. As I think we said, and I think we provided a link to the town hall slides from the ICs. They're excellent. They all went into detail about the plans, about budget comments, about the quality, really, really good data that every institution should take a look at and kind of do some self-reflection on how their institution looks. But these are the observations about the budget themes that were discussed by the ICs. And as you can see, I forget the percentages. I think for a couple of the ICs, there were 0 budget requests for a relatively large percentage. And for much of the remainder, if there was a budget, there wasn't much detail. And so one of the things that we want to continue to talk about is, and Melissa is going to talk about it here in a couple of slides, is personnel support. That's probably one of the larger potential budget categories. And we want to specifically talk about that, as well as some of the other collaborations with librarians, investigators, and obviously repository fees as well. Next slide. As I mentioned, the priority is still continuing on phase 1. As discussed, we haven't received yet a lot of feedback on just in time on the plans. So there's still more work to do, still more opportunity there, a lot more, but we do want to have some pre-planning thoughts. And these are some of the big areas that we wanted to begin to talk about in phase 2. One is about improving the budgeting of costs, right? Per the IC responses, probably likely that many of us are aware in our own institutions. And I just threw a couple of bullets down. Melissa is going to talk in just a moment about potentially creating tools. We'd love to hear if anybody has anything out there. Also want to talk about allowability of various costs. Monitoring, like that's what that whole cost was about. Is it a direct cost? Is it an indirect cost? Could it be a service center? How are we going to do things like that? We'll probably talk a bit about post-closing costs. Again, it could be storage costs that actually happen after the end of the award. And also there's been some early on discussions about modular budgets and the caps there, and how do we put things in the budget when we know there isn't going to be adequate funding. And then in the background of our mind, which kind of goes to the earlier discussions, is understanding the total cost of the institution. From the very beginning, Michelle and NIH have been sensitive to that. There were lots of discussions about small and emerging institutions and how they can afford it. These are great questions that we're all committed to making sure that we talk more about them. Next slide. And I think I turn it over to you now, Melissa.
Yep, thanks, Jim. So at least at my own institution, and I'd be interested if anyone else has a different experience, you know, by and large for standard routine data storage, we don't require, we don't direct charge for that. You know, we have some library services that could be used as a fee for service. And then, you know, we have, you know, repository fees, but then most people are using either NIH repositories that don't have a charge with them. And so we're really expecting that personnel effort represents our most significant DMS cost. And it can be really difficult to think about what is that right percentage of effort. You know, we've heard some anecdotes. Oh, well, you know, it takes 50% of the amount of time it took to generate the data. It takes 50% of that time to clean it and prepare it for deposit. You know, we know that NIMH has prepared a wonderful cost estimator tool, but that is specifically for deposits into the NIMH repository. So it's for a very specific type of data, using a very specific type of standards, going into a very specific repository that provides some supports. And so I think that what is happening is that, you know, our researchers don't really have a good way to estimate the portion of personnel time that's going to go into DMS activities, and are not including those in their estimates that are provided to NIH, which, you know, I'd also be interested if anyone else is experiencing something different, but leads us to have a lot of zero or very small dollar budget amounts that are being reported in proposals. Because of the struggle to kind of really think about personnel costs. I think there can be a potential double whammy there. I know I saw at least, you know, one comment in the chat about, you know, how much work it can really take to implement these plans. And I think thinking about how much all of these activities, how much time and effort it will really take to do all of those activities and do them well is probably an important part in writing a good, you know, realistic, implementable DMS plan. You know, we just talked about oversight and management, and that's sort of one of my great fears, is that we'll overpromise. You know, far better to underpromise and overdeliver than overpromise and underdeliver. Michelle, I hope it's okay that I just said that. Anyway. So what we thought we could do as a sort of a great activity that would help us bridge the gap between phase 1 and phase 2 and help us start working on teasing apart some of the costing components is to maybe take a look at, is there some resource, calculator, estimator tool that we could come up with to help faculty provide an estimate for the personnel time that would go into DMS activities, both to help them evaluate the sort of achievability of their plans, as well as provide more accurate figures for NIH, because I think it makes us all nervous. I don't want to speak for NIH, but maybe NIH included, when we see $0 budgets, but we know that this isn't free, that these activities, you know, probably have costs associated with them. And we're still struggling to figure out how to quantify that. And I do see some agreement in the chat that personnel costs are actually one of the biggest direct costs. So what we wanted to do is kick off a working group to actually start looking at, what might we do here. And so if anyone is interested in donating some time to help us start thinking through what a tool might look like, do we need to start with some sort of data collection? Could we come out with some sort of a tool and through a data collection vet its accuracy? And also, so if you are interested in volunteering, send us an email. It's the same email address that we had previously posted for if you were interested in participating in phase 1. And then if your institution has already posted resources for estimating, the amount of time that goes into any of these activities or other budgeting tools that you think would be useful, we'd love to have samples of what folks might be providing in terms of guidance as well. Oh, and I see one interesting comment in the chat that an institution is discussing sort of a rate that might include all kinds of things like curation, cleaning, prep, and de-identification services. Rosemary, are you thinking that would be something like a service center to help provide those support services that would have rates then that researchers could include?
Oh, I'm sorry. Yes, we've just, we've kind of struggled with this because we have people doing this, but they have like 5 other jobs, including me. So I did like the discussion about, earlier about the oversight kind of being, maybe tackled that way, because we're just not sure how we're going to be able to effectively support this when the awards start coming in. So that's what we were thinking. We've been working with our F&A person in finance about it, but we haven't gotten anywhere yet. And the problem is most of us are in the F&A rate, so we can't we can't split it out. So we're just trying to figure out the best way to do it.
Yeah, are you thinking of something maybe like a service center that would provide those services?
I think we would probably keep it decentralized, because we have a really strong committee that I lead, and we pull people in and out. We meet all the time. We talk about updates. So we're pretty good at that. Although I do see with a lot of the data things happening in the other spaces that maybe that is needed, and that we would focus on just data specifically and making sure that these services are there, but we still may put them in the departments they belong in at our institution.
Yeah, I think Jacqueline Lucas made a comment in the chat, and I think that's exactly one of the reasons that we're thinking of starting, or we'd like to start with an activity like this, is that, we've moved away from the single line item, but there is still a need to provide a realistic estimate of DMS costs in the budget justification. And I think that I think that a lot of institutions might have a similar experience where it's really researcher time devoted to DMS activities that may form the largest chunk of that. And what is there some sort of an algorithm? Could we ask ChatGPT to come up with estimates for us that both would help researchers come up with realistic estimates, but then also provide something for grant managers and central administrators to kind of gut check or use to justify, right? So, we could come up with something like are your data needs low, medium, or high? Data size or data volume, some indication of data volume. And then, I'm oversimplifying it. I'm sure it's a little bit more complicated than that. And then say like, okay, so we recommend if you have, 3 postdocs, 0.75 of an FTE is going to be needed for DMS activities. And then, you know, if we can come up with some sort of resource like that, then it makes it a little bit easier for researchers to kind of estimate the amount of time. And then it's something that us research administrators could use to kind of like verify what we're listing, because there is still a need to estimate what this costs. And I think we're still struggling when it comes to personnel. Oh, and so then Jacqueline is asking about the correct way to plug that into the budget and budget justification, which I can say what I think, and then Michelle or Kristen, if I'm wrong, please correct me. But I believe if you're including, say, 100% of a postdoc, and the estimate is that 10% of that person's time would go for DMS activities, you still put 100% of the postdoc in the personnel line item. But then when you get to the budget justification section on DMS activities, you want to include 10% salary and fringe for that person in the DMS estimate. And you want to mention that in the budget justification.
Thanks, Melissa. That was also my impression. We had at least one GMS experience some confusion about the way we had budgeted it. So perhaps there's just a training item there.
Yeah, and I think there's another question about
maybe we can issue an FAQ on that just to be helpful.
That would be fantastic. Thank you.
Okay.
And then I think there was another question about changes to the DMS budget. But again, Michelle and Kristen, correct me if I'm wrong, but I don't believe there's been a new prior approval requirement added in the event that right, it's, if you don't ask for the funds, then you don't get the funds, right? But once you have the funds, if it's not that rebudgeting to or from DMS costs, it is a new prior approval requirement. I think, and Christi, correct me if I'm wrong, I think, is that our last prepared slide and we're into the discussion?
That's correct.
So I think we have about 15 minutes left. Our session goes to about 3:45. So if folks have questions on topics that we didn't cover, or other thoughts or suggestions, or in particular, if you've got suggestions on how we could get started on the personnel effort / cost estimator, we are welcoming any thoughts folks have right now.
And we do recognize that there are a lot of questions, concerns about budgeting beyond just personnel. But I think to be reasonable, we felt like this was a good place to start, because we're hearing the feedback that this is challenging, and not ignoring that there are other challenges. We will, I think, as Melissa has said, phase 2 point ABCD, we'll get there. But starting with these effort or personnel sort of estimators is a good place to start. And as, regardless of the organization of your institution and the offices involved in this, that's something that everyone has to address in some way.
I see that Kirsten popped a comment in the chat that contracting is complicated with regard to NIH DMS roles and responsibilities. And Kirsten, are you thinking of subaward, contracting with subrecipients, or something else?
Yeah, exactly. We're trying to train our investigators to have those conversations at the proposal stage so that it's clear which scientific data will be shared. between the participating institutions and who is actually responsible for depositing it. But it is a challenge to train our investigators to have these conversations at the proposal stage because they're not used to it. And it might be helpful if a template was really clear on these points, actually, so that it was more clear.
Feel like there are some opportunities for collaboration with our subawards subcommittee colleagues in terms of that, because I can see some opportunities in the subaward templates maybe to facilitate that as well. I see one question about whether all data or just successful experiments need to be deposited. And Melinda, I think there's probably some content in the FAQs that you might find helpful, just in terms of the scope of data that needs to be shared. It's the first section of the FAQs on the sharing.nih.gov website. And then I think, maybe a consultation with your program officer, just because that's a very programmatic question in terms of, what is a failed experiment? And then sometimes even failed experiments, we learn something from them, right? So. So many good comments in the chat, trying to keep up. There are some questions related to effort certification in the chat as well. So I think a couple folks have mentioned effort certification, but this one says it really well. If the appointment of the postdoc is 90% research and 10% DMS activities, does the effort report need to reflect this, or just 100% of the postdoc's efforts were devoted to the project? And we've talked a lot about how DMS activities are sort of part of doing good research. I think, in the proposal budget, you reflect 100% of a postdoc on the project. And then when you go to certify their effort or report their participation in the project in the RPPR, you would similarly reflect just 100% of the effort, because the DMS activities that they're performing are still part of the research project. Does that sound right to you, Michelle? I've received clarification that our session actually ends at 3:40 instead of 3:45. The fun of scheduling things in Zoom.gov. And I believe we have another session right at 3:45. So poor Sarah does need probably 5 minutes to be able to get ready for that next session. So we've got about 4 minutes left, and we will definitely, save this chat. Please, Sarah, help me make sure that we save this chat. Think about trying to provide answers for any of the questions that we didn't get to, or, definitely take them back for discussion of potential resources that we could do through the pilot to help with some of the points of confusion or the questions. Michelle, Christi, Jim, any closing comments anyone wants to offer?
Just to re-express our gratitude to Michelle and Kristen and the ICs that have been involved in this. It's been very fruitful. I think we've already learned a lot. I think we're providing good information, good feedback, and certainly couldn't do it without the involvement of NIH. Thank you.
Absolutely.
Yep. Thank you.
Great.
The collaboration from Opera and all of the wonderful IC colleagues has just really been really impactful, and I think a great opportunity for all of us. So. Great. Well, thank you all. We'll give Sarah a whole 7 minutes to prep for her next session then, which she put in the chat is Science CV Common Form. Oh, and 3:50. So there you go. She can have a whole 12 minutes. All right. Thanks
everyone.